Hello, today I'm going to talk about antenatal care program, which is one of the preventive maternal health services. Okay, I'm going to talk about it as a health service and the disparity around the world related to it. In the next sessions, I will talk about other relevant issues and problems related to pregnancy and antenatal care as nutrition and vaccination. Well, antenatal care can be defined as the care provided by skilled healthcare professionals. A skilled healthcare professional is a doctor, a nurse, or a trained midwife to pregnant women and adolescent girls in order to ensure the best health conditions for both of the mother and baby during pregnancy. And we are going to talk about the skilled healthcare professionals again and their role in preventing maternal mortality in next sessions. Okay. Antenatal care is a core component of maternity care. It's grounded in human right-based approach. So it could happen anywhere in a health facility or in home, as you see, as the WHO recommends. The components of antenatal care include risk identification of the pregnant and the baby, prevention and management of pregnancy-related or concurrent disease. This is very important because we are checking the pregnant women in antenatal care for all other chronic or infectious diseases. So many of the health problems the women can pass by are identified and managed during pregnancy and during antenatal care. Health education and health promotion. Of course, pregnant women need specific health education and health promotion activity and programs. A positive pregnancy experience. This is the WHO new guidelines for pregnancy and antenatal care. So I give you the link here. Please, I advise you to go and download it and read it. It's very extensive and very comprehensive report and very helpful for understanding what is meant by positive pregnancy experience. It aims to maintaining physical and socio-cultural normality, maintaining a healthy pregnancy for mother and baby, and of course, we did preventing and treating risk, illness, and death, having an effective transition to positive labor at birth, achieving positive motherhood, including maternal self-esteem, competence, and autonomy. The new guidance increased the number of contacts of pregnant women from 4 to 8, doubled. It doubled the number. So this is the minimum now, 8 contacts, not 4. Why? Recent evidence indicates that higher frequency of antenatal contacts reduce the likelihood of stillbirth. This is evidence-based from research. This is because of increased opportunities to detect and manage potential complication. 8 or more contacts for antenatal care can reduce perinatal deaths by up to 8 per 1,000 births when compared to 4 visits. It recommends pregnant women to have their first contact in the first 12 weeks of gestation, in the first term, with subsequent contacts taking place at 20, 26, 30, 34, 36, 38, and then the final week of 40 of gestation. So it is increased numbers of contacts, frequent ones. It's quality, not only quantity. The quality antenatal care should be available for all women to ensure a positive pregnancy. It will encourage women to seek skilled care at childbirth. skilled birth attendants will be trusted at that time. And so we will avoid women seeking help from traditional birth attendants. And there are a lot of complications, and we will talk about it in the next session about maternal mortality prevention. And it will reduce stillbirths. We said that frequent we will identify if there is any complication or any abnormalities that could affect the mother and the baby. And it will help women to get care and counseling for other concurrent diseases and health like HIV, malaria, TB, and other conditions. There is another recommendation for the ultrasound examination. This is the link, and you can also download and read the report. It recommends, the WHO recommends one ultrasound scan before 24 weeks of gestation to estimate gestational age and improve detection of fetal anomalies and multiple pregnancy, reduce induction of labor for post-term pregnancy, and improve a woman's pregnancy experience. It does not recommend routine ultrasound scan after 24 weeks. However, if an early ultrasound scan was not performed, so we can consider performing a scan later in pregnancy to identify the number of babies, fetal presentation, and placental location. One potential benefit of an early ultrasound scan is correctly to increase the accuracy and precision of gestational age assessment, which facilitate appropriate management of threatened preterm births and post-term pregnancies. Comprehensive health system support for a minimum standard of ultrasound service. Of course, this is a challenge in low resources setting for logistical and infrastructure and financial challenging. Okay. Now, here is the disparity in antenatal coverage. And this is for 4 visits. This is from the old data that for at least 4 visits. This is before the implementation of the new guideline. And there is already disparity in coverage. We find that there are countries of low income countries like Afghanistan, Bangladesh, Chad. They are having less than 1/3 coverage of the pregnant women. Very low coverage, while it is almost universal in high income and Western countries. USA, Finland, Canada, Bahrain, Australia, Armenia. So there is a contrast by the country income classification. I performed analysis of demographic health survey data of 28 countries from low income and middle income countries. And my analysis showed that there is a disparity in the same country. It could happen in the same country between the household income level and the economic level. While the richest household have higher coverage, almost universal, and the majority of them similar to high-income countries, we find the poorest segments of the population have less coverage of antenatal care. There is disparity by residence. Urban residents have higher coverage in comparison to rural underserved populations. Women education level. I always consider women education as the strongest empowerment factor because educated women has to care for themselves, for their health, for their baby, for their families. So highly educated women have universally caring to have antenatal care, while Those lacking education or with basic education has less than coverage. So disparity is there in antenatal care coverage as well as other health service. Well, thank you for watching today, and don't forget to like and subscribe to my channel to get notification of my next presentation. I look forward to seeing you soon. Best of luck.